breast. The breast are the paired organs on the anterior thoracic wall and consists of the mammary glands surrounded by the connective tissue. The mammary glands are modified subarachnoid glands, sweat glands that are arranged into the lobules on the ducts that produce the milk, which serves as a nutrition for the infants. The breasts are the rudimentary and usually the non-functioning in men. The shape and size of the breast change during the woman's life and the menstrual cycle. Breasts are supplied by the axillary, internal thoracic and the intercostal arteries, and they are innervated by the branches of the cervical plexus. The breasts are the paired organs on the anterior chest wall and are composed of the modified upper and sweat glands. They are arranged into the lobules and the ducts. Location: the anterior thoracic wall overlaying the deep fascia and the pectoral muscles. At the level of the rib 2 to 6, from the sternum to the mid-axillary line, with the nipple in the first intercostal muscle. Here we can speak about the structure of the breast. They are paired, tear-shaped, and are of varying size, each composed of the mammary glands surrounded by the connective tissue. The mammary gland, modified apocrine glands, arranged into the lobules of the ducts. Adipose tissue, the 80% of the breast in the non-breastfeeding women. Nipple areola complex. The gland ducts, they converge and open into the skin in the mammary papillae. They are surrounded by the areola, which is the circular area of the darker pigmentation, which contains a sebaceous montogamous gland to lubricate and protect the nipple during the breastfeeding. Deep pectoral fascia. Attachment of the breast to the pectoralis major muscle. The space between the breast and the muscle is the retromammary space. While speaking about the ligaments, another one is the suspensory ligaments of the breast, which is called the Cooper ligaments, that run between the pectoral fascia and the skin, between the secretory lobules. In the lateral view, the first one is the chest wall, and the muscle is the pectoralis musculature, and the lobules are present on the nipple surface. We can find the areola, and after the areola, we can find the lactiferous ducts, and at the end, we can find the adipose tissue, which is attached to the skin. In the development, they begin as a thickening of the chest wall, leading to the mammary, reach to the milk line. The nipples and the breast duct system are present at the birth. Further development during the puberty is under the influence of the female sex hormone. The breast size increases during the pregnancy and reduces after the menopause. Lactiferous duct, that is a passage from the alveoli to the nipple. Dilation at the ends, lactiferous sinuses. Their function is milk reservoirs. The stroma, the adipose tissue and the suspensory ligaments surround and supply the lobules and the ducts. The ductal system, the epithelium surrounded by the myoepithelial cells, myxolobules. The terminal are the lactiferous ducts, major ducts. Then they converted into the terminal ducts, and we can also find the lactiferous sinus, which is a milk reservoir. Lactiferous sinus, this is a milk reservoir. Then they turn open into the nipple. We can find the prolactin, progesterone, and the estrogen. They stimulate the proliferation and the growth of the breast secretory units. While speaking about the neurovasculature, the arterial supply to the breast is via the branches of the subclavian, axillary, and the intercostal arteries, with the venous drainage into the subclavian, axillary, and the zygous vein. The innervation is from the branches of the second to the sixth intercostal nerves, with the normal hormonal input via the prolactin. Lymphovascular supply. The arterial supply. The medial breast internal thoracic artery, which is a branch of the subclavian artery. Lateral breast. The lateral thoracic of the abdomen branches from the axillary artery. The mammary branches from the intercostal artery. Venous drainage. Accompany the mentioned arteries, they drain into the subclavian, axillary, and the zygous vein. The sensory sympathetic fibers, they are supraclavicular nerves of the cervical plexus and the branches of the second to the sixth intercostal nerves. Here they are innervating, and the lactation is stimulated by the prolactin. For the clinical relevance, we can say the mammography. This allows for the early detection of the breast cancer or the precancerous stations before they develop into the invasive breast cancer. It is recommended to start the routine annual mammography screening after the age of 40 years. The fibrocystic changes. The benign changes that mimic but do not achieve the threshold to be considered. The malignant conditions of the breast. Fibrocystic changes are those that may be seen even in the normal breast tissue. For the mastitis, the inflammation of the mammary gland tissue, which can be lactational or the non-lactational. Individuals will present with the warmth and the tenderness of the inflamed area. The first line treatment consists of the beta-lactam antibiotics such as dicloxacin. In case of fat necrosis, the ranging condition. The fat necrosis can occur anywhere in the breast and can affect the women of any age. This condition is characterized by the firm, round lump, which is usually painless, but it may present with the tenderness or pain. Gynecomastia. They are the benign enlargement of the breast in the males due to the glandular proliferation, the giving breast a characteristic rubbery nature. Gynecomastia. They are caused by the medication that deliver the estrogen levels such as cimetidine. Fibroadenoma. The benign breast muscles that are usually mobile on the palpation. The fibroadenomas, they are commonly identified in the young women and represents the diagnostic changes for the surgeons. The fibroadenomas, they do not typically turn into the breast cancer, so it is safe to just monitor these masses. In case of breast cancer, the mastocarcinoma, this is a malignant tumor of the mammary gland. The point of origin may be either the mammary gland duct or the lobules. Breast cancer, mastocarcinoma, this is the malignant tumor of the mammary gland. The point of origin may be either the mammary gland duct or the lobules, leading to the ductal carcinoma and the lobular carcinoma respectively. The breast cancer is treated with the surgical excision, plus or minus radiation and the chemotherapy. Nipple discharge. In lactating women, the nipple discharge can be classified as either galactochorea or non-milky nipple discharge. Galactochorea is usually caused by the endocrine disorders or the medication, whereas the non-milky nipple discharge is usually linked to the benign tumors.